Alright, so I'm going to be doing the wound dressing as my sterile technique. My setup here really isn't the best, so if it's not working, if you can't really tell if I've kept sterile technique, it's fine, I understand, and we can just figure out a day for me to come in and do it in the lab. Tried to get as much in here as I could. So, okay, so all this is right there. Okay, so first what I would do is I would verify the medical orders, and I would gather up all of my supplies. I would then go into the patient's room, closing the door behind me. I would don any PPE that I needed, and I would perform proper hand hygiene. I would then identify the patient and introduce myself. Once they told me their name and their date of birth, I would double check it on their wristband. So then I would assemble my equipment, my sterile pack, and I have a extra pair of sterile gloves, which I'm just going to toss over here. Then I would let the patient know what we are about to be doing and why we're going to be doing it. And at that time, I'm going to address their need for any kind of pain relief, whether it be non-pharmacological, pharmacological, or pharmacological. If they need any kind of medication, I'm going to go ahead and administer the appropriate medication, and I'm going to give it time to reach its effectiveness. If they don't need anything, we can go ahead and start the procedure. I'm going to take a trash can, and I'm going to put it right here in front of me, so that way it's easy to get to. I'm going to then adjust the bed to elbow height, and I got my patient right here, and I'm going to assist them into a comfortable position, so that way it's easy for them to lay there for a couple minutes, and it's easy for me to access the wound, and that the wound the cleaning solution can flow from the top to the bottom, so from the clean to the dirty. So for this, I'm going to position the patient to a somewhat lateral position. Sorry. That should be good. Okay, so now I'm going to drape the patient, so that way the only thing exposed is the wound that I'm going to be working on. I'm then going to put on some clean gloves, and I'm going to let them know that I'm about to start removing the dressing, and that when I pull off the tape, it might pull a little bit and it might be a little uncomfortable. So if I go to start removing it and I start to meet resistance, or it feels like it doesn't want to come off, I can use a silicone-based adhesive remover, and I can use that to help get the bandage off. And if it starts to stick, if some of the skin starts to, or the wound tissue starts to try to stick to it, I can use some sterile water or sterile saline to make that a little bit easier. So once I've got this open, I can take a look at this, and I'm going to notice the signs of any drainage. I'm going to look for what type of drainage it is, the color, if there's an odor to it, and what color it is. I think I already said that, but and then I would take this and I would dispose of it in the proper receptacle. I would then assess the wound. I would be looking for the stage that it's at. I would be looking to see if there was any necrotic tissue. I would look to see if there was any tunneling or undermining, drainage, granulation tissue, epithelialization, and then I would also be measuring the wound. So I would measure it from the longest to the widest area. I would then remove my gloves, and using sterile technique, I'm going to open up my sterile supplies away from me first, making sure not to touch more than an inch. touch myself with this as well. I would then grab my sterile gloves and I would place them right here. I would then take my container and I would dump it away from myself, making sure I get everything out of here. And I would place it on the other bedside table that I had set up. I would then take my sterile saline that I had next to me. I would lip it if it's a used bottle. If it's not a used bottle, I believe you don't have to lip it. So in this, we're going to assume it's a used bottle. So I'm going to lip it into my trash receptacle. And I'm going to fill up 2 of the small basins with saline water. I'm going to then, making sure not to touch my sterile field, I'm going to open up my gloves, making sure I have the cup end down. I'm going to open up the right one and the left. I'm going to do the right one first. Make sure not to touch the actual glove itself. I will then scoop this one up. And apply it to my left hand. I will then take this and drop it into my place receptacle. So I can now start to put all my supplies where I need them. My forceps, my scissors, my 4x4s, my bandage, my swabs. I'm going to take a couple of these and I'm going to stick them in the sterile saline that I have over here. And then at this time, I'm going to start cleaning the wound. I'm going to open these up. And I'm going to start cleaning the wound top to bottom. And then I'm going to make sure I use some of my gauze pads. And I'm going to dry the area, disposing of those. I'm then going to apply any skin protectant if needed to the area around the skin or around the wound. I'm then going to begin to pack the wound with the sterile gauze that I have over here. So I'm going to grab my gauze out of here. I'm going to start to separate it. And I can use my forceps and a gauze Q-tip. So I'm going to start packing the wound, making sure not to touch the patient. Use a different one of these. Finishing packing it. Once the wound is nice and loosely packed, I'm going to dispose of these. And I'm going to take a couple of my 4x4s, my gauze squares, and I'm going to place them over the top of the dressing. I'm going to take my pad. Also, before I applied the gauze to the wound, I would have squeezed out any excess saline that had absorbed into them. I'm going to apply my dressing with the blue line facing up. I now no longer need to be sterile. I'm going to remove my gloves and discard them. I'm going to grab start applying tape to make sure it's on there nice and tight. I'm going to then gather up all of my supplies and discard them into my waste receptacle. I'm then going to label it with my name or my initials, the date and the time. And then I'm going to place the patient in a comfortable position. I'm going to make sure they don't have any immediate needs. I'm going to place the bed at the lowest possible position, put the side rails up, and make sure their call bell and their phone are within reach. I'm then going to perform hand hygiene and remove my PPE. And I'm going to let the patient know that we're going to be coming back every shift, at least every shift, to assess the wound, and more often if the wound ends up becoming saturated more quickly.